can you extrapolate out how many potentially fatalities there would be given the rate of infection that you've seen so far?
No, we can't extrapolate, and what we've seen here is, in fact, consistent with the fact that younger people, as opposed to the oldest group, in most past years, about 90% of the deaths have been in those over 70 or over 65, and in this case it's been young adults, primarily the average age, but there's been everything from a few months to age 90 some odd, so there's been a wide range. It's not possible to extrapolate, just like we can't say exactly how much H1 flu we're going to have. Some of the studies suggest that a number of people with H1 have, in fact, almost no symptoms, may not have any fever. The good news is that the H1N1 on average does not at this point appear to be any more severe than the seasonal flu that we're used to.
In terms of its mortality rate?
In terms of the overall impact, and including mortality rate. But again, it's very hard to get at this directly because we don't know the denominator. We don't know exactly how many people have gotten this. But the limited data that is available suggests that it's roughly of the same virulence as the seasonal other A strain flus.
The 25 deaths and the 157 known hospitalizations, for what group is that for the state? Is that for the nation?
That's for Los Angeles County. There have been, as of August 13th, I think, there were 477 deaths nationwide from attributable to H1N1. And in about 80% of those were individuals with an underlying condition. Now, pregnancy is an underlying condition, but of course diabetes, heart disease, respiratory problems, other kinds of diseases that make people at higher risk for complications of any respiratory infections constitute that.
Do you recommend that those populations stay away from concerts, any kind of big type of public events?
At this point, we're not suggesting anything special other than the respiratory hygiene. But as time goes on, we will look at the opportunities and look at what we think can best protect the public, because that's job number one.
This could be, I'm sorry I'm late, so could you repeat how many people so far has infected H1N1?
We don't know how many people are infected. We know that we've had 157 reported hospitalizations and 25 deaths attributable to H1N1 since the start of this, which was in the spring.